My name is Fabrizia Faustinella. I'm one of the fortunate recipients of the Copello Health Policy Fellowship. Today I will talk about Medicaid expansion advocacy in Texas, a daunting task. But before I go ahead, let me tell you a little bit about myself. I'm originally from Italy, from Perugia, a medieval town right in the center of the country. From there, I moved to Texas, where I've been working in Houston, in the heart of the Texas Medical Center, for many years. Here I have met many enthusiastic colleagues at Baylor College of Medicine and other institutions. I quickly came to realize that my work as a physician could not stop at the office. Therefore, I became engaged in advocacy, and I was very fortunate to cross paths with Doctors for America. As a Copello Fellow, I have worked on a Texas Medicaid expansion advocacy training. I have published op-eds on Medicaid expansion, and I'm currently promoting voter engagement as a health equity strategy. Why Medicaid expansion? Because Texas is one of the 10 states which have not yet expanded Medicaid. It is estimated that almost 2 million additional Texas residents would be covered by Medicaid if the state accepted expansion. In addition to that, Texas is leaving on the table billions in federal money by not accepting expansion. The Texas Medicaid expansion training took place in March. At the training, we learned about the status of Medicaid expansion, about advocacy strategies, about sharing our personal story. We also learned about talking with patients and the public about public health and understanding the connections between equity, racism, and public health. The FA announced and publicized the training on their Facebook page. Texas can't afford to not expand Medicaid is the title of the first op-ed, which I published in collaboration with my colleagues Drs. Chetal Shah, David Auerbach, and Alex Gajewski. The op-ed was published in the San Antonio Express News in March, and once again, Doctors for America amplified our voice and our impact by posting the link to the op-ed on the DFA Facebook page. Shortly after, MedPage Today published a second op-ed by the title, "Here is what Medicaid expansion can do for the health of your state." In both op-eds, we have emphasized the overwhelming positive impact of Medicaid expansion on access to care. We have also emphasized how Medicaid expansion can be achieved without additional pressure on the state budget. Therefore, Medicaid expansion, it is the morally and fiscally responsible thing to do. What about future directions? Voting is an extremely important issue, and I'm currently working on a DFA-sponsored resolution on voter engagement as a health equity strategy. Public policy shapes our health ecosystem, affecting access to comprehensive healthcare, education, jobs, and housing. Healthcare policy is determined by politics and who's in office. A less representative government results in less inclusive public policy. Voter participation has a large effect on electoral outcomes. Doctors for America recognizes that voting is emerging as an important and actionable upstream determinant of health. Here I am encouraging my patients to register to vote. The pillars of voter engagements are voter registration, mobilization, education, and protection. With augmented, unbiased voter participation, elections would yield government that is more representative and public health policy that is more equitable while reducing costly and preventable health disparities. I'm going to leave you with an inspiring quote from James Baldwin. Not everything that is faced can be changed, but nothing can be changed until it is faced. Thank you very much, and thank you, Doctors for America.